The health behind the hiccups, medical conditions that impact male sexual performance. Let's face it, sexual performance isn't just about desire and chemistry. Behind the scenes, a symphony of bodily systems must work in perfect harmony. When one instrument falls out of tune, the entire performance can suffer. For many men, difficulties in the bedroom aren't just a matter of mood, they can be warning signs of underlying health conditions. Erectile dysfunction, a common culprit. The most commonly discussed issue is erectile dysfunction, ED, the inability to achieve or maintain an erection firm enough for sex. While the occasional misfire might be nothing to worry about, persistent ED often points to deeper health concerns. When the blood doesn't flow. Erections rely on healthy blood circulation, so it's no surprise that vascular conditions like atherosclerosis, clogged arteries, and peripheral vascular disease are major offenders. These conditions reduce blood flow, making it harder for the penis to respond as expected. Nerves in the game. Then there's the nervous system. Neurological disorders such as multiple sclerosis or spinal cord injuries can interfere with the messages your brain sends to, well, down there. If the nerves can't communicate effectively, an erection becomes a challenge. Diabetes, double trouble. Diabetes is a double-edged sword. Excess sugar in the bloodstream can damage both blood vessels and nerves. The result? A higher risk of ED and a possible decrease in sexual sensitivity. Hormones running low. Low testosterone, also known as hypogonadism, is another key player. Testosterone fuels not just sexual desire but also physical function. When levels drop, libido and erectile strength often follow suit. Medication side effects. Sometimes, the medicine that's keeping one part of the body healthy is throwing a wrench into your sex life. Antidepressants, blood pressure meds, and even some antihistamines can have unwanted side effects in the bedroom. Beyond the erection, other sexual challenges. ED might take center stage, but other sexual issues deserve a spotlight too. Premature ejaculation. When the fireworks go off too soon, it could stem from psychological triggers like stress or relationship strain, or it could be linked to medical factors. Either way, it's a common but treatable condition. The vanishing libido. A declining sex drive doesn't always mean the spark is gone. It could indicate hormonal imbalances, chronic illness, or emotional health concerns like depression or anxiety. Even certain medications can play a role in turning down the heat. Trouble reaching orgasm. Orgasm disorders, including delayed or absent orgasm, can be complex. Sometimes it's physical, sometimes psychological, and sometimes a mix of both. The important thing is not to suffer in silence. The takeaway: talk it out. The good news? Most of these conditions are treatable. The first step is a conversation with your doctor, not just your partner. Open dialogue with a healthcare provider can lead to diagnosis, solutions, and a healthier, happier sex life.